Hi, this is Curtis Alexander. In today's video, I want to cover Ubrelvy, which is a new or fairly new migraine medication. I put the generic up here. It's called Ubrelvy. I just put up there. It's really hard to say, but it's fun to say once you get it down, so you can impress people at dinner parties or wherever. So, at any rate, Ubrelvy 101. So, I already mentioned it's used for migraines, not chronic migraines, but acute. So, if you're have a migraine right now, it's something that you can take. Now, it's in a new class. In the past, the most common way to treat an acute migraine, was with the triptans, the Imitrex, the sumatriptans, that kind of thing, and they act pretty quick, and it's something you can take. Now, this is a new class. I've talked before about some of the drugs in this class, and they're injectables, and it's called the CGRP blockers. Aimovig is a good example, but it's injectable. Ubrelvy is a CGRP blocker, but it's something you can take by mouth. And again, the other CGRP blockers, the Aimovigs, are used chronically to treat chronic migraines and help prevent them. Ubrelvy is used, you take it right now for a migraine you're having right now. So what about the dosage? What makes Ubrelvy unique is the way that it acts, and some other things we'll get into here in a sec. But so as far as the dosage, Ubrelvy comes in a 50 and 100 milligram strength. Normally what your dose is anywhere from 50 to 100 milligrams. When you feel a migraine coming on, like the triptans, you can repeat a dose within 2 hours. You're not supposed to go over 200 milligrams a day, and I put an asterisk here because that's the highest dose. In people who have any form of liver or kidney disease, that dose needs to go down. You need to make sure that your doctor and your pharmacist catch that if you're in that group of people. And normally what we see is 50 to 100 milligrams total daily dose. So we need to be careful in those. If the kidney disease is bad enough, you just can't use it because your body can't clear it, can't get it out of your system. As far as side effects go, I haven't seen a ton of people take Ubrelvy, but what the studies show us is the number one side effect is nausea. If you're having a migraine, you're usually nauseous anyway, so hard to tell if it's the Ubrelvy or not, but 3 to 4% of people experience nausea with it. The other one is some drowsiness, very small, percentage, 2 to 3%, but it's something that you can see. Big question is how fast can it act? Now, we know that when you take a Ubrelvy tablet, it takes about an hour and a half for your blood levels to get at their highest point. That doesn't mean that it's going to take an hour and a half, just means that's the peak, the time it takes for your blood levels to peak. You're probably going to notice effects much sooner, anywhere from 15 minutes, half hour, you're going to start noticing that, but it does take about an hour and a half for your blood levels to peak. CI is contraindications, or when you absolutely can't use Ubrelvy, and this is important for you to know. Again, we kind of touched on kidney disease. You either have to lower the dose substantially or not take it. It depends on the severity. Your doctor will know from your blood levels. It's called your creatinine clearance. That's one of the big ones. They're going to see how well your kidneys are working, but be aware of that one. The other one is there are some significant drug interactions with Ubrelvy. So we want to watch out for what are called CYP3A4 inhibitors. And a CYP3A4 is just a really fancy way of saying that's one of your liver enzymes, and it's involved in metabolizing or breaking down a lot of different kinds of drugs. The problem is when you take any of these three classes of drugs, these are some of your strongest CYP3A4 inhibitors. So if these drugs inhibit this enzyme, it means your Ubrelvy can't be broken down, or it's going to be broken down much slower. Blood levels build up and you can get toxicity. So there's certain antibiotics, mainly the macrolides, which is like erythromycin and clarithromycin. That's a big blocker of this enzyme. A lot of the HIV medications are a big blocker of this enzyme, and also your azole antifungals. So your fluconazole, So anything that ends in an azole, keep an eye out for that, because it can block this enzyme again. Ubrelvy goes up. But overall, I really like Ubrelvy. I like the possibilities of what it can do. You're starting to see more migraine meds coming onto the market because it's a huge issue in this country, but they also tend to be a little bit on the expensive side. So, but Ubrelvy is one that we're excited about. We think that it can genuinely help people, and it offers people an option outside of triptans, the most common acute migraine medications, particularly people who have a history of stroke, those kind of things. They're not supposed to be taking triptans. So Ubrelvy gives you a good option. So again, Curtis Alexander, please give me a thumbs up. Let me know if this video was helpful. Subscribe. And again, just reach out. If there's other topics you need me to cover, I'm glad to do it. So again, until next video, appreciate you watching.